work, and have fun. Fortunately, depression is treatable.
So we're going to talk about some contributing factors. There is a variety of contributing factors that lead to depression. This mental health condition affects every individual differently and can cause depression in one person and may affect them way differently in another. So the first contributing factor we'd like to explore is self-esteem. This is the way an individual overall perception of themselves. It's how we feel about our abilities and our limitation. When we have a healthy self-esteem, we feel good about ourselves and our self-worth. And when we have low self-esteem, we may devalue our opinions and our ideas. So low self-esteem can lead to mental and physical health issues. On the other hand, high self-esteem can also be unhealthy and lead to mental health issues. The other contributing factor is life-altering events. It is common for depression to occur after a serious medical event, and this may include a heart attack, stroke, or serious diagnosis such as cancer. Older individuals with long-term conditions are likely to experience similar negative events on their emotional and physical well-being. Loneliness, we'd like to explore that contributing factor. Social isolation and loneliness are linked, but it is possible to feel lonely without being isolated. Loneliness and isolation can have a negative quality of life outcomes, including poor physical and mental health, such as high blood pressure, obesity, heart disease, low self-esteem, and depression. These can lead to premature mortality. Isolation happens when there is a mismatch between the quantity and quality of our social relationship and those we want. Social contacts are essential to the quality of our lives and help avoid loneliness. So the other one we'd like to explore is stress. The effects of long-term stress can be harmful and contribute to depression. Chronic stressful life situations can increase an individual's risk of developing depression if they are not coping well. Stress can also cause several other adverse health problems, including heart disease, diabetes, obesity, and high blood pressure. We'd also like to explore grief and loss in relation to depression. After experiencing severe loss, it is not unusual to experience depression. Loss is not always referred to the death of an individual, but can also include loss of a pet, loss of a job, a divorce, loss of independence, a loss of a driver's license. And we'd like to identifying this depression, signs that can help us to identify depression. Depression may exhibit as a loss of interest, meaning not enjoying activities that we once did or not wanting to participate in activities. It could appear as a persistent low mood. It is normal to have a low mood from time to time, but when it's constant, it is concerning. It could be getting irritated quickly or frustrated with little things. Depression can negatively affect an individual's mood and cause feelings of hopelessness, sadness, and tearfulness. This mental health condition could cause sleep disturbances, such as difficulty sleeping or sleeping too much. It could also cause thoughts of self-harm or suicide. It is important to reach out for help when experiencing these thoughts, even though it may be difficult. Depression can also present itself as tiredness, loss of memory, or changes in appetite.
So there are many ways to treat depression, and not all of which include medications. So the treatment of depression is specific to the uniqueness of the individual and their situation. It is important to remember that it's not one size fits all. Each approach and intervention needs to be tailored to suit the needs of the individual. A strategy that may help one person cope might not help another. So therapy is a way to cope with depression. And for most mental health conditions, the best therapy is counseling and cognitive behavior therapy, which is also known as CBT. Therapy can improve communication and interpersonal skills. It can increase self-esteem, and it can improve your mood. CBT is a goal-based therapy that teaches individuals strategies to reduce negative or unhelpful thoughts and behaviors. It involves changing the way you think and behave in dealing with everyday challenges. So another way to cope is by staying involved. When experiencing depression, it may feel easy to withdraw socially and to keep to yourself. Social life is a very important aspect of health, and by staying involved, it will lower your risk of feeling isolated or lonely. Social connections can help keep you from becoming more depressed. To make staying involved easier, try engaging in activities that you've once enjoyed. This might include going to the movies or going for a walk, catching up with friends, and it's important to try to push yourself to stay involved with your community as well. Eating healthy is another way to cope. It can lower symptoms of depression and anxiety. It is shown that a diet rich in fruits, whole grains, vegetables, fish, olive oil, and low-fat dairy is associated with a lower risk in depression. Whereas a diet rich in amounts of red meat, refined grains, sweets, high dairy or high-fat dairy, and alcohol products is linked to a higher risk of depression. So alcohol is considered a depressant and can make the symptoms of depression worse. Alcohol can also cause negative interactions with any antidepressant medications. Eating a good source of protein multiple times a day, such as beans or fish, can clear your mind, boost your energy, and also help your mood. Boosting your self-esteem can also help with depression. And we discussed negative effects of that self-esteem can have on mental health before. To cope with depression, an important aspect of treatment is finding ways to feel better about yourself. You can boost your self-esteem by practicing positive thinking, by focusing your thoughts on your best qualities, and by spending time with people who make you feel good about who you are. Eating a healthy diet, getting regular exercise, and doing things that you enjoy will also help you have a positive attitude about life. So exercise has physical, mental, and emotional benefits that can help people going through depression. It can relieve stress, make you feel good about yourself. It can boost your self-esteem. It helps with brain function and focus, and it makes you physically fit. It is recommended to incorporate 30 minutes of moderate exercise at least 3 times a week to see these benefits. So the amount of rest that you get each night has a large impact on your mood. People with depression often have noticeable sleep disturbances, which can include too much sleep or not enough, like we said before. Either of these disturbances can lower your mood and increase the symptoms of depression. This feeling of exhaustion or low mood can make it difficult to be social, to get exercise, and to manage stress. To avoid this, it is recommended to go to bed and wake up on a regular schedule and eliminate distractions before bed like TV or a phone.
All right, so now we're going to jump into discussing medication, which is my area of expertise. But especially with depression, medication is really only a part of our treatment strategy. It is not our primary method of treating depression or really any mental health condition. That is the therapy either directed by a therapist or a psychiatrist or a psychologist, or cognitive behavioral therapy, which is more self-directed. Give me a second here to pull up my slides briefly. I hope. Nope, I'm on it. I'm in. We're good. So, one of the most important first things when we are discussing mental health is depression, anxiety, whatever mental health condition it is reducing the stigma associated with it. Often we hear people say, well, just get over it. But no one ever tells you to get over your diabetes. No one ever tells you to get over your high blood pressure. Why? Because we recognize that those are medical conditions, health conditions that we have no control over. But depression, anxiety, obsessive compulsive disorder, bipolar disorder, they're the same. They're medical conditions that we don't have a direct control over. Reducing the stigma is one of the best things we can do to help our friends, our family, acquaintances on the street be able to better deal with these medical conditions. Because the more we talk about it, the more we sit here and discuss depression, anxiety, mental health, the more people are going to do it, and the more open people are going to be to talking about it as a medical condition and not something you can just get over. When we talk about suicide and mental health, many people think that it's only depression that can lead to a suicide attempt. And while depression certainly is a very common contributor, it's not the only one. There are patients with many other mental health conditions that have this same high risk. And it's not limited to young people or old people, to rich or poor, to male or female, to whoever. It's universal. It can impact anyone. And that's why it is so important that we work on reducing this stigma so that we can ensure that people are getting proper treatment for these medical conditions. When we move on to treatment and medications, we need to look at the fact that medications aren't the be-all and end-all of treatment with them. For most mental health conditions, as I said at the beginning, as Sam and Seamone said, therapy is really the best way to help. But a lot of people are afraid to access therapy because of the stigma. So we do use medications as additional treatment methods for depression and other mental health conditions. Because they're very useful, they're easy to access, you can get them quickly without having to go on waiting lists, without having to really talk to someone. Yes, you have to go to your family doctor or to a clinic or to your nurse practitioner, but they're relatively easy and quick to access. And therapy does take time to work. So do the medications. They can give you some short-term relief in certain instances, but for the most part, when we're looking at medications for depression, it can take 6, 8 weeks to even find out if a particular medication we start you on is going to work for you. One of the reasons for that is we don't fully know how these medications work. Yes, we know what they do in the body, but we don't know how that impacts depression, anxiety, obsessive compulsive, bipolar. We don't have that information because really we better understand the depths of space and the vastness of the oceans than we do the human mind. The other issue is depression, just as it doesn't look the same in every person. The medications don't work the same in every person. What works for you might not work for me. And unless we can really narrow that down, and we're making good strides in that now, doing genetic testing to really see if there are certain drugs that you may or may not respond better to in the mental health space and outside of it, it's still very personalized and does take some trial and error. When we are looking at antidepressant medications, they come in a wide variety of different options, and I'm not going to get into, what each drug class does and all that, because it's really more than we need to get into in order to help people with depression and anxiety at a community level, which is what we're focused on right now. But what you do need to know is that they do come in a wide variety of different ways of working, and all of those different medications have different effects and side effects. And so it's important that we tailor your treatment not just to your mental health conditions, but also looking at your other medical conditions, which is especially important when we talk about depression in seniors, because our senior population do tend to have a wider variety of medical issues than, say, a healthy teenager whose only real medical condition is their mental health issues. And it makes treating it a lot more complicated when we have to take those other medical conditions into effect, or into consideration. And using antidepressants is still very much an art and not a science. We still very much use a trial and error method to make sure that we get the right therapy for you. It may take 2 or 3 different trials through different drugs, different medications to get one that works for you. We may get it right on the first shot and you're good for 6, 8 months, and then you start to relapse a little bit. Just as a diabetic can be really good for 6 to 8 months, and then their A1C starts going up, they start getting higher blood sugar. You can have relapse and treatment. It's not uncommon, and it's not a bad thing. Like any other medical condition, it's running a marathon. It's not a sprint. We're going to have stumbles, and you just have to get up and keep running. So we do use multiple medications very often in patients with mental health conditions, as we do with diabetics, as we do with people with high blood pressure. As with any other medical treatment out there, antidepressant treatment is not without side effects or risk. Common ones include nausea, insomnia, or sleepiness. And this can go along with the particular medication or the particular person. Just as depression, as Sam said, can cause either sleepiness or excessive lack of sleep, the treatments we use can do the same thing. It's also very common for it to cause dry mouth, dry eye. All of the mucous membranes in the body are very common to be dried out by antidepressant therapy. And that can include, for females, vaginally as well. And it can also lead to sexual dysfunction in both male and female patients. And this is important, especially for us to consider when we're talking to our patients, because that in itself can lead to a worsening of the depression. If they think there's an issue there, it can cause relationship breakdown, which, as we've discussed, is also a cause of depression. And anything that can cause depression can always worsen it as well. So it's important that we have an open and honest discussion with our patients, with the people we are speaking with, about the side effects of these medications so that they're prepared for them. And there are things that we can do to help deal with these side effects. Another really common issue, and both in young and old, is drug interactions. These medications that we use to treat depression can interact with a ton of other drugs, herbal supplements, vitamins, minerals, and it's really key that we discuss what you're taking before we start you on a medication. And yes, that goes for any medication. But with these types of medications, it is a little bit more important, especially when we're looking at your over-the-counter stuff that's not documented really anywhere, because those have a lot of issues with it as well. Another really key point is the increased risk of suicidal thoughts and ideations. Well, you might say, Aaron, are we supposed to be stopping that when we're treating depression? Yes, that's what our goal is. The problem is, the medications work in different ways in different people, and as I've already said, it is an art and not a science. We are not to the point in medical science where we can pinpoint exactly what is wrong with each person, because the physiologic cause of depression can be different in every single person who we're treating. So it is very important that we educate people on the fact that just because you're depressed does not mean that you may not, or that you're being treated for depression, does not mean that those are going to go away or not get worse. Call if you need help. Be able to have that discussion of that risk with people. Very often, depression is not found alone. You can find it in patients who are pregnant, who just had a child. Postpartum depression is very common. Patients with anxiety, with high blood pressure, cancer diagnosis, diabetes, all of these people can have depression. An otherwise healthy person can have depression. But it's very often not found alone, and we need to treat those other issues that could be causing the depression or that are caused by the depression. It's very common to see someone who's depressed start developing anxiety about their depression. Very often have someone who's anxious start developing depression because of the anxiety. And so we need to adjust treatment and add other things on to help treat anxiety. There's sleep disorders. If they're having excessive sleepiness, we can work with them to build better sleep hygiene so that they're able to get up and ready. If they're having an extreme lack of sleep, we can provide short-term sleep aids to help them get the rest that they need, which will, in the long run, help with the depression. And we also need to consider any other mental health conditions they might have and how the treatment for the depression will interact with that condition, as well as adding additional therapy on for those other conditions. Again, as with everything we've discussed, we need it tailored to the individual. Depression can impact anyone. It can impact me, it can impact you, and it has impacted me. These last 2 years especially have been hard on everyone in general, but for myself personally, I was not able to see my fiance for the last 2 years. I was not able to see her from March of 2020 to January of 2021, and then from January until August. It was a very long 2 years for us. I already had mental health issues, depression before that, and that made it much worse. And so it can hit anyone. And it is important to reach out, to talk to someone. That's what I did, and it helps immensely. Don't be afraid to ask for help. It doesn't matter where you are in life, whether you're 70 and just had a new grandbaby, or you're 20, 30, and separated from a loved one. Reach out, get help. I will now turn it over to Sam and Simone to briefly finish up with a discussion on some community resources.
So here's a list of some community resources that are available to reach out in a need of crisis. So all of these are listed on your handouts in front of you. And it's important to know that it is okay to reach out for help. So like Erin said, there's a lot to deal with during these times, and it's important to take time for self-care and your mental health. Remember that we are all human and that you're not alone. Does anyone have any questions? No?
All right, well then, thank you very much for coming to our discussion on depression, mental health. Again, if you have any questions that you're afraid to ask in public, reach out after. I'll be hanging around the center for a little bit, as will Sam and Simone. Just come up to us and ask. Have a wonderful day.
Thank you.